Bore da chroeso a gyfarfod y bwrdd. Good morning and welcome to today's Digital Health and Care Wales board meeting, public board meeting. As is our usual practice, we're holding the meeting virtually and people will be able to view the meeting live, or there will be an opportunity after the meeting to access a recording of the meeting via our website. Simultaneous translation facilities are available. If you need to hear a translation, then if you hover on your screen and there's an icon towards the middle of the bottom of the screen says English, says language. So if you hover on that and choose English, you'll get the English feed in simultaneous translation. If in relation to today's board meeting, note that when, as is often the case, we might not necessarily be looking at this at the camera, so please excuse us if we probably have got papers on another screen or in front of us. And we're going to be taking two breaks through today, one 10-minute break and a 30-minute break for lunch, and we very much hope to have completed today's meeting just after 2 o'clock. As you'll be aware, board members, that if you had any questions on the consent agenda, I hope you've brought those to the attention of the relevant officer lead. I don't think nothing's been brought to my attention that you'd like to have raised in the board meeting, so thank you very much. Before apologies for absence, I'll welcome for presence, which is Rowan Gardner, who's rejoined the board after a brief sabbatical because of work commitments in her real life, her other life. So welcome back, Rowan. We very pleased to see you back with us at today's meeting, and I know you've been involved in other activities already since the beginning of May. Apologies for absence. We've got one apology for absence, which is Alistair Class-Neil, and also Andrew Fletcher, who is with us but may need to leave the board meeting a little early. Andrew is actually on leave this week, so we're very grateful for you joining us, Andrew, but I know you may have to leave a little early before the end of the meeting, and please feel free to do so. Declarations of interest. I've had no declarations of interest indicated to me. I should probably also point out that because of IT issues, where they are, Ridian and Ivan are on the same screen, which is fine, but it's probably just worth noting that that is the reason why they are sharing a screen today. I've not been noted, as I say, no conflicts of interest. Has anyone got any that have occurred to them since? Okay, thank you very much. If we move then now to part 2 of the meeting, the consent agenda, and I will go through these. I don't think anyone wants to raise anything specifically on them, but please do shout out if you wish to. So the first is we're approving the minutes from the board meeting held on the 28th of March 2024. People happy to do that? Thank you. We're noting that there are no actions on the action log, item 2.2. We're noting the forward work plan, item 2.3. We're receiving for assurance the DHCW 23-24 decarbonisation returns, item 2.4. And we're receiving for assurance, finally receiving for assurance, the more than just words annual report, item 2.5. Thank you all very much. And if we move on to part 3 of the agenda, and I'm going to hand over for our shared listening and learning presentation. And today is a slightly different approach. And I'll just hand over to Ridian Hurl, the Executive Medical Director, to introduce this item. Ridian, over to you.
Thank you very much, Simon. You can hear me? You can, good. There's a video which we're going to start. I'm anticipating that colleagues are going to start.
The situation that we had before with requesting any form of radiology, so invariably X-rays, CT scans, MRIs, would be that we would write that down on our paper form and we would either send that off to the radiology department for them to send out an appointment, or if it was more urgent or certainly more X-rays are more likely, that patients would collect that paper and either arrange their own appointment or go down and wait in radiology to have that done. The new system that we have adopted recently has been that we request that scan electronically on the system. Patients can then either turn up to a radiology department to have that X-ray done, but more complex requests such as CT scans or MRIs are then sent an appointment. In this particular instance, our nursing home resident who is bedbound, who required quite complex transfer, had to go and have an X-ray in radiology. There was a form that had been left out because one of my doctors was still using the paper version. Now, normally that would mean someone from the home would have to leave and collect a form from our reception desk, then arrange transport, take the patient down to radiology, wait around for a prolonged period, and then obviously have the X-ray and come back. The home neglected to collect that document and still arrange transport. So I got a call saying that the patient had to have ambulance transferred down to the hospital. They had to take members of staff out of the home to be with them. They were sat in the radiology department and they realised that they couldn't actually ask for the X-ray because they'd forgotten the form. I suggested that a better option would be that I complete an electronic form there and then. That took me, as I say, a matter of seconds. Radiology received that immediately, and there was no delay, therefore, in the patient receiving that X-ray. They could go straight through and avoid the time for the care staff and ambulance transfers waiting around as well. And less distressed for the nursing home patient, being in an unfamiliar environment would have been distressing the longer they had to wait there. The alternative would obviously have been that perhaps a member of staff would have had to have travelled all the way back up, which is probably about a 40-minute round trip to collect the form. If we'd used an electronic form in the first instance, would have hopefully been more efficient for the patient and staff.
That now, if you can hear me. Okay, so colleagues, simple things like sending for an X-ray suddenly turn into pathways. Patient time is wasted, potentially appointments are missed, and there's a service cost to that. The benefits of electronic requesting include the fact that the gets there, is legible, no more doctor's handwriting. It allows the radiology department to schedule it a more effective throughout their department, and it reduces the risk. And one of the risks associated with radiology is the radiation risk associated. So what this short video does, I'm grateful to GP colleagues for engaging, is using systems that we've provided. They've been able to patient the right treatment in an appropriate time frame in the right environment. So I'm happy to take questions on that, Simon.
Thank you, Rydian. Just for you and Ivan to be aware, your sound isn't ideal. We're losing about every sixth word, so there may be some things you need to repeat when you come to introduce your items, Ivan and Rydian. We can pick up what you're saying, but as I say, about every sixth word is dropping out. Okay, I've got a number of questions. Marion, and then David, and then Rowan.
Thank you very much, Chair. And can I start by saying how lovely it was to see that practical example there of a success story of this system. I have two brief questions. How many GPs, or what proportion of GPs actually use this system regularly at the moment? And what are the possible barriers, I wonder, that may be hindering those who are still using the paper forms from using this electronic system?
Marion, can you hear me?
Yep.
We have some problems with the connectivity for the translation. So I got the last bit about people using paper and people using electronic systems. Was that the...
And how many GP practices are currently using it? And what are the potential barriers to them taking up use of it. That's correct, isn't it, Marion?
That's it. Yes, great. Thank you.
Okay, so regarding primary care, it's there are 3 practices, I believe, that have trialled it. As regards to secondary care, there are hospitals such as the Princess of Wales that have it in some departments. Other hospitals are using a different system. So there's a mixed patchwork of use. It's a local decision to switch it on with a local configuration in a radiology department for their scheduling. We hope, and our ambition is with the new RISP programme, that there'll be a single way for a clinician in Wales to request from anywhere, providing the patient the choice of where they might go for that test, should it be available in that location. And ultimately, a clinician, for example, a tertiary clinician in Cardiff, who's looking after say a cancer patient in West Wales, should be able to make the request so that the patient goes for their scan, let's say in Glangwili, rather than have to come all the way up to Cardiff. With the addition of mobile scanning, we might even find that it's available in your local Sainsbury's car park on a Tuesday afternoon. But the reality of the situation is we need to get the request and the patient and the equipment in the same place.
Your sound is much better now, I'm pleased to say. David, you did have your hand up. Did Marion ask the same question that you were going to ask?
Exactly, Simon.
Right,
Yes.
okay. Rowan.
Thank you, Simon, and thank you, Rydian. That was a really great example of how digital can reduce cost and reduce clinical waste, and improve patient outcomes by just enabling people to have benefit. And I think that the point I wanted to make was, that was also a wonderful example of how people living in nursing homes whose care is being delivered within the NHS, but is also perhaps, I don't know, but also perhaps being paid for by local government arrangements in a sort of wider social care setting. And so it's quite hard, Rydian, in terms of articulating value in pounds, shillings and pence, to be able to reflect that across a complex system. But congratulations on a great video that just nailed that use case. So thank you. Really great to see.
I'll pass that on to the team.
Thank you. Is any other questions? You said there were three GP practices currently piloting it.
Yeah.
What have we got any idea of what promotional activity will go on if the pilot works, and what sort of time scale we might be working to? Yes,
Simon. So it does work. There are 2 elements to this. There's the acceptance of a local radiology department to GP requests electronically on their workflow. So we'll work with our various superintendents across the radiology departments in Wales to enable that functionality. And the access to Welsh Clinical Portal within the GP community is very widespread. It's actually easier via one of our suppliers than the other, but we're trying to make it as smooth as possible within the workflow for the GP partners and doctors. And we are currently running a Power BI dashboard showing the numbers of investigations. There are some things to iron out. So, for example, some radiology departments control what primary care clinicians can request. So, for example, an MRI would perhaps only be available for a secondary care clinician to request. So that's something that they have to determine a local department. We've got an excellent team working on this with Sally Pritchard, working very closely with the radiology community, particularly the superintendents within departments who are doing the scheduling.
Because I assume it also has the potential to reduce pressure on GP waiting rooms and GP consultations. I mean, I was thinking the protocol around a persistent cough is you are, you know, for whatever period it is, you referred to an X-ray. Well, there's potentially no need for you to actually go in, see the GP, get the piece of paper, go home, ring up the hospital.
Absolutely,
which
you could have
takes
a video. Yeah, you could have a video consultation or a telephone
a
consultation.
telephone. Yeah.
Yeah, and then the GP can request it.
Rowan.
One last point, really, and I just wanted to bring this out as you were describing the tools that we're using, just how much value we're getting out of the Microsoft license that we have, and the architecture that we've been developing. It's not always obvious to people how these things get created, but really nice example of how a flexible architecture with sort of standard tools is adding value to what we can deliver as well to our colleagues in the wider system. So really good example.
Thank you.
Thanks, Rowan. Okay, Ridian, thank you very much, and please pass on our thanks to the board's thanks to the team who were involved in this and working on this, because it's another great example of how life can be made easier both for the patient and for the clinicians involved. Great. If we then move on to the main agenda, part 4, and the first item is mine and Ruth's, the Vice Chair's report. There's just a couple of points in mine I'd like to draw your attention to. The first one needs your endorsement, which is adding myself to the Programme Development Committee. I've discussed this with David, who's the chair, and he's happy for me to join as a member. So if I could just seek the endorsement of that from the board, thank you. Just then a couple of other things. On my chair's objectives, I had a very useful meeting discussing the draft objectives. I think it was on the 28th of April. And I'm now awaiting a revised set of objectives following that meeting, which I'm sure will come soon. And as soon as they are, I'll share them with the board, because obviously they become organizational objectives immediately. I have them. The chair peer group, we had a very useful meeting with Fleiss, the Fleiss chief executive. The chair was due to attend, but he's not well at the moment and couldn't attend. Introducing and talking about their strategy, and I attended previously the launch of their strategy in Cardiff on a date in May, which I can't quite recall at the moment, but it was I was pleased to be able to attend that. They've got some particular focus around digital, and particularly around AI and the citizens' relationship with AI, which I think we'll obviously be connecting with them quite closely with over coming months. And those are the only three things I wanted to draw out of my report. If you have any questions, please ask them. Ruth, is there anything specific you wanted to pick out from your written report?
Nothing to add, Simon. Deal.
Thank you, Ruth. Okay, so I can receive that report, and then I'll move on to the next item on the agenda, which is the Chief Executive's report, and hand over to Helen.
Neil, Simon, and morning everyone. Just a couple of things to highlight from me. It's all there for colleagues to review. But I just wanted to pull out the leadership development programme that we've been taking forward across the organisation. So we've got the King's Funding who are supporting our senior leadership development programme, and we've done a number of roundtable discussions where we've had people come and talk about kind of their careers, and I'm really pleased to say that Judith Paget, the DG for Health and Social Services and the NHS Chief Exec, joined us last month to talk us through her kind of career and her thoughts, and took quite a number of questions actually from the team. So it was great that Judith was able to spare us that time. It was a really great session. We've had some fantastic feedback from the team there. And also thanks to two of our colleagues on the board meeting today, Claire and Ridian did a double act, and they went through kind of their career journeys and some of their kind of key drivers and thoughts about the future. So really great. I think a number of quite challenging questions actually from the team, but it was great to be party to that, and thank you to colleagues for supporting the programme. We've got actually a full day event next week where we're all in person in the Cardiff office to do our last kind of big face-to-face. So looking forward to seeing everyone next week. We've also done our half yearly or end of year really directorate review for each of the directorates. So this is my chance to hear from each of my members of my team and then their senior team to pull out on performance, lessons learned, challenges and risks, and doing a bit more of a deep dive in that kind of immediate focus areas that the directorates are taking forward. I find the sessions not just informative, but a really great opportunity to hear from the teams within the directorates and some of the exciting work that's going on, and a chance to for us to have a collective kind of challenging discussion where one's needed to try and work through some issues. So really enjoyed those sessions. And then finally, really just to draw out, we've had a huge number of nominations for our staff awards. So really pleased that we had such a level of interest in the organisation and a great kind of response to that. And really look forward to seeing everyone who will be there at our award ceremony the 12th of June, I think that is. So that was it for me, Chair. Happy to take any questions.
Thank you very much, Helen. Don't see anyone's hand going up. Okay, thank you. Asked to receive that report, which I'm sure we're all very happy to do. If we move on to the next section of the agenda, strategic items, and item 4.1, the stakeholder engagement plan update, and ask Ivan to introduce this item. Over to you, Ivan.
Thanks very much. I'll be speaking in Welsh for this.
Okay.
If you could just hold on a moment, because really sharing my screen, I've got the soundtrack on. English. Okay. With any luck, hopefully now that should be okay. So it's really a pleasure for me to present, hopefully you can hear me, to present this report on stakeholder engagement. I know that this is something that is important to the board and that the members are very interested in it. And you'll remember that we approved our strategy around a year or so ago in 2023. I'd like to emphasize two things and then just touch briefly on what's in the report that you've got today. Firstly, we've continued to recruit into the engagement team in order to develop the resource that we have here centrally. But more importantly, that team has been working with teams across the entire organisation, because we don't want to centralise our engagement work. We want to be very clear that engagement with stakeholders and partners is everybody's role across the organisation in its entirety. We have over 1,000 people working for us. We want all of them to be engaging with stakeholders and working as ambassadors for our organisation. So they are supported by the team centrally, but mainstreaming engagement across all we do is our aim. And the strategy has 4 streams to it. So very briefly, I'll touch on those and then I'll take some questions and comments from members. Firstly, what I've just touched upon, and that's stream 1, which is strengthening our engagement work across all teams. We've been doing that through good practice sharing sessions, learning sessions, general resources, and support and advice for teams across the organisation. There are several teams who are developing engagement plans so that their work has a pattern to it, and that's a really good thing to see. Secondly, we are trying to create the second stream here, then we're trying to create structures that make it easier to engage via fora and networks and series of meetings on a regular basis with our partners in particular, i.e. the health boards and health trusts, but also with some of our strategic suppliers as well. Rowan talked about Microsoft, for example, and we have several suppliers, commercial suppliers, who are absolutely key to us. We have a very close relationship with them, and we want to develop that work through regular meetings at a high level. So that's the second stream, and we have seen good progress in that over the past 9 months. The third then is that we are identified as a leader across the system. We're recognised. And the fourth pillar then, the fourth stream, is that we listen to our stakeholders and that we are able to show that we are responding to the feedback that we glean from them. This is tied in to objective 5, which is that people trust us as a partner. And what's happening at the moment is that we are in the midst of a stakeholder survey in that regard in order to ask our partners and stakeholders what they think of us. whether they understand our objectives, whether they are satisfied with the relationship, and then we will be responding to that in order to be totally open and transparent in the way in which we work with our partners, so that we have trust in them and they have trust in us. So I'm very pleased of the progress the team has made and the way in which the team is developing and delivering against the strategy. I hope that members are happy to see the progress that we've made, but I would welcome any questions or comments. Thank you.
Diolch, Ifan. Ruth.
Diolch, Ifan. It's really good to see the progress that's been made and across such an important area. And I particularly like the focus on the fact that we've got 1,000 people out there who are our ambassadors, who should be engaging. I wonder if you could just touch a little bit more on what do we do with all of the intel that they are going to bring back to us? Because having everybody delivering our message is one thing, but then actually listening to that feedback and creating that loop is another challenge. So I just wonder if you could reflect on that for me, please.
Certainly, thanks, Ruth. I think it's a combination of informal and formal, and although we are in the middle of a formal exercise, so we've commissioned an external partner, Atos are currently doing a stakeholder engagement survey and review, which involves questions as well as an online survey, so structured questions with certain individuals. And that is important. And I'm looking forward to seeing what we get back from that. I think actually the informal is more valuable, and it's not about trying to suck all of that informal feedback together into Nadine and the engagement team in order to digest it and to do an analysis and then play that back to the teams. It's helping them to develop those relationships and then to work on that. And then if there are things that are of real significance for the whole organization, those are the sorts of things that we'd want to play back to the engagement team and to our management board and to our weekly exec meetings, because our relationships with our stakeholders and with our delivery partners especially are extremely close, and we meet with them almost weekly in many cases with their digital directors or with Welsh Government. So there's a constant informal feedback, but I take that as a sign that it's a healthy relationship, that we're working very closely with people, and that those are quite open and candid relationships sometimes. So it's not always rosy. There are lots of pressures that we're working together towards. So I think that combination of the informal and the formal is how it's working for us at the moment.
Thank you, David, and then Marion.
Thanks, Simon. Thanks, Ifan. Just reflecting a little bit on what you've just said. How the stakeholder engagement is all about improving our relationship and getting to the state where we're a trusted strategic partner for all of the health boards. Are we able to sort of baseline where we think we are and then understand the progress we're making towards where we'd like to be? Is that part of the external assessment you're trying to get?
Well, this is the first formal stakeholder engagement survey that we've done. So I think this will give us a baseline to work on. That the strategic objectives that we have set in the strategy that the board approved at the end of March has got some, it's got some clear aims for 2030 about being in the top quartile of stakeholder engagement for a survey. So we haven't baselined that or defined, quartiles of what. There are different ways. So for the feedback that we get from the users of our systems, that would be something like the class survey, which we did last year, or which the system NHS Wales did last year. But for our wider organizational stakeholder engagement, we need to baseline and work out what we're measuring it against. I would say that we're measuring two things. So one is the quality of the relationship that we have, but also important is why that relationship is necessary. So the quality of the delivery that we work together. Okay. So how exactly we're going to distinguish between those two things, because I think it's important that we look through the relationship to what the relationship is intended to achieve, which is more effective and efficient delivery of better quality services across the NHS in Wales. So both those two things go together, and we're expecting in the midsummer, I think, to get the results of that report back, which should give us some more structure to work from.
Great, thanks.
Thank you, Ifan. Marion.
Thank you, Chair. And I'm sure we all appreciate the wealth of engagement that is identified in the report that Ivan's given. And it's very, very encouraging to see the strategy bearing fruit. clearly it'll be very interesting to see the outcome of the stakeholder survey. You also state in the report that there will be a need, because of the budgetary restraints we're facing as a public body, that there will be a need to review our priorities in this regard. Of course, the stakeholder survey will influence perhaps those decisions, but maybe you could elaborate a little bit, if you can, in terms of what you think at the moment may be driving our priorities into next year. Well, I think that it's about what things to do first and what things are valued most by our stakeholders. And it's not just about the limitations we face in terms of our resources, but what actually limits our partners' resources as well, because we have to engage from both sides, and time costs and people's attention costs. And when there is a shortage of resources overall, then it inevitably places pressure on relationships, because very often both partners may want to prioritize different things. And we see that through some of our programs at the moment, where health boards have their local pressures and local priorities that are not always the same as the national priorities set out when the programme was first established. So it's very difficult to say what will be prioritised, what will be slowed down or perhaps halted, and what will be accelerated. But what I can say, and I am confident that we will continue to work and maintain an ongoing close and open conversation with our partners to ensure that everybody understands what we're doing, and that we are as open and honest as we can be together. And I really, really do feel that that is happening. The personal relationship has strengthened, deepened between, for example, the group of digital directors and also the programme and project leaders locally. So I feel that those relationships really have matured over the past 9 months, and that is something that we will have to really draw upon. Thank you. Thank you. It's good to hear that, Ivan. Thanks.
Thank you, Ivan. Thank you. I don't see anyone else wanting to raise any questions. So thank you very much, Ivan. We note that report, and please pass on our thanks to Nadine and all the team involved in the engagement work that we have been doing and continue to do and will be doing. We move on to the next item now, which is 5.2, which is the communication strategy plan update. And I'd invite Chris Dallin, the board secretary, to introduce this item. Chris, over to you.
Thank you, Simon. Yeah, so this is an update on the delivery of the communication strategy. The strategy was approved by the board in September 2023, following engagement both internally within DHCW and externally. The strategy includes 5 strategic aims, and it links very closely to this stakeholder engagement work Ivan's just described. So that the strategic aims include to establish DHCW's reputation as a trusted strategic partner, to build our internal communication, supporting staff to feel informed and empowered, to develop our stakeholder communications, building relationships in partnership, to grow our public communications and building an understanding of our role and how digital and data can help the NHS in Wales work better. And the 5th one is to enhance our digital communications to reflect our purpose as a digital organisation. So the strategy is supported by a yearly action plan, which outlines the activities we plan to take to achieve those strategic aims. So this update for the SHA board, not the management board, as it states in the paper, but the update today is the last 6 months reflection of progress against that year 1 action plan. So I'm just going to run through some of the key points of progress, and also areas of focus and areas that we need to do more work on. So in terms of the first strategic aim around developing our reputation as a trusted strategic partner, we launched a new branding for DHCW in the autumn of 2023. That followed a fairly major audit of all our branding within the organisation. I think there was over 30 sub-brands, which was, I think we felt, diluting the corporate image of the organisation. So that's been rolled out now across DHCW in terms of programmes and directorates, and it's supported with clear guidance for all branding across the organisation, internally and externally. We've developed a DHCW webinar series proposal that's been approved for implementation later on this year. We're planning to start that in the autumn of 2024 to try and put us into the thought leadership space, with partners coming in to discuss and debate digital and data considerations moving forward. We held a Senate event at the end of last calendar year to promote DHCW to political representatives and build relationships with these stakeholders. We did that in partnership with the Bevan Foundation, and we're developing case studies of where work we're doing is delivering with partners and supported by testimonials, and that was illustrated by Ridian this morning on the listening and learning item. In terms of some further focus in terms of this strategic aim, I think understanding the feedback, we're currently doing an audit of our branding work through the quality and regulatory team. So working with them to understand where there are deviations, if there are, and addressing those, targeting digital health events to make the biggest impact in the UK and internationally. And we are planning to do a Senate event in the autumn to follow up on the work we did with the Bevan Foundation. In terms of our internal communications, we've held 5 staff briefings over the last 6 months, or between September and March. We regularly get over 500 staff tuned into these. We piloted our first hybrid staff briefing, which was the most well-attended staff briefing DHCW have had in its since we established, so that was really positive. And we continue to work with the people and OD team to run key events for staff. We've launched a new campaign, I Am DHCW, that was launched to celebrate our staff, and that's been really popular across a number of channels, and I think reflects the popularity of people-focused content that we put out. That is our most popular content. We've increased the amount of 10 talks that we've delivered over the last 6 months, and that's really through demand from staff. So responding to staff. In April, for example, we had 4, average attendance was close to 200 staff attending those, and that was on a range of topics. We've also worked closely with the Welsh language leads within the organisation to improve and increase our bilingual content moving forward. In terms of future focus areas for our internal communication, so we are going to introduce some technical 10 talks. Again, this is an idea that's come through from staff for some very technical focused 10 talks. We are continuing to work with the people in OD team to make sure there's good content on our SharePoint site. That is often the most visited site within our SharePoint site for staff, so we're working closely on that. And as Helen mentioned earlier, we've got the staff awards coming up. We had over 260 nominations, which is fantastic from the staff within the organisation. And we've got our first hybrid staff conference in July. In terms of stakeholder communications, very much touched on some of the areas Ivan talked about. And I just wanted to pick up one of the points Ruth made about intelligence from staff. So we have established an engagement and communications network. So that is a network of engagement and communication staff from across DHCW that come together to share intelligence, to understand what's happening out with partner organisations and stakeholders. We've had over 80 staff from within DHCW attend those, so they've been really popular. And we've had guest speakers from partner organisations attend the network, share good practice, and share an understanding of perceptions from outside of DHCW. So I think that's really important for us to keep that soft intelligence coming through. We've also got representation at a number of national communication groups. So there's a weekly Welsh Government group that we attend. There's a Welsh NHS Confederation peer group and a CDPS Communities of Practice, all of which DHCW are members of. In terms of future focus, I think the stakeholder engagement survey is going to be key for us. So Ivan mentioned that. I think understanding perceptions and being able to respond to that and understanding where stakeholders feel our role is and isn't, and ensuring there's clear alignment and understanding. So that's going to be really important moving forward. In terms of public communications, our social media continues to grow. So engagement levels across our channels benchmark better than health and digital sectors. So that's positive. We have a social media reach of 44,000. That's excluding X. And our engagement rates benchmark really well. LinkedIn is our fastest growing platform, and the engagement rate there is 20%, so way over where you would want to be. So that's really positive. We are undertaking a review of our website, so that's going to be a clear focus moving forward. And in terms of our digital communications, the fifth and final strategic aim, we've purchased some digital kit to make sure we can do as much in-house filming and other creating digital content ourselves. And we've delivered training to DHCW staff and communications professionals from across NHS Wales on digital communications. I think the annual report illustrates where we've moved into the digital content. So we produced our first HTML that's had over 2,500 hits now, or views of that annual report. And the most popular item is the chair and chief executive video. So I think that shows where people want to look. You know, people want quick content that shows them, gives them an overview of what's happening quickly. So that's a quick run through of some of the progress over the last 6 months. There are areas that we are still focused on that we need to take forward over the next 6 months. So we need to finalize some of our core messaging, and we need to develop a repository of spokespeople for key subject matter areas, and the recruitment of staff into communication ambassador roles. So we'll continue to monitor over the next 6 months, and then develop the second year action plan to support the strategy towards the end of this year. And we do focus very much on the metrics and what that's telling us to try and ensure that the communication and the content that we provide is reflecting what we're hearing as well. So Chair, I'm asking the board to note the update and areas of focus moving forward, and happy to take any questions.
Thanks, Chris. I've got two, Sarah Jane and then David.
Thank you. I'd just like to say, I think it's been very transformative over the last year and a half, really. It's come a long way. The internal comms in particular, I think, has been really seamless, working with the people at OD team in particular in terms of content and range, and the movement of the communications business partners as well. I think it's been really successful. So for me, I feel a real felt change, and I think the team is very seamless across the organisation, and it's been really transformative in its approach and in its delivery. So well done to the team, and they're a great group. And I think additional people such as Sarah Ann as well, who aren't actually part of the comms team, help put the backgrounds together today for our Pride Month support. There's lots of additional people that make the team work, but yeah, great team and really great stuff that's been achieved. So well done to all the team, Chris.
Thanks, Sarah Jane. David and then Marilyn.
Thanks, Simon. Thanks, Chris. Some really great work. I monitor the social media quite regularly because I'm an avid user myself, and I really like the I am DHCW. I think that's really gives us an insight into what we do as an organisation. I just want to ask a question around the metrics. So I would hope that with the improvement we're seeing in the external engagement, that might actually trickle through into people expressing an interest to come and join us from a recruitment perspective. Is that something we're trying to measure? Because I think if we could make a connection, that would really underpin what you're trying to do with this strategy.
Yeah, so David, I think it does. Our recruitment website page is our highest hit, our highest attended page. So we get most hits on join DHCW. So we know we are attracting, and likewise LinkedIn from a social media perspective is by far our highest growing or quickest growing platform. So I think it is transforming, but we are keeping a close eye on it.
Right.
Marilyn.
Sorry, yes, I just wanted to comment and say just fantastic work that you've been doing, Chris. One of the things I was just wondering was, I don't think people are always aware of how much work has been done. So, for instance, with the 10 talks, I know that members of staff have said to me, have personally messaged me, emailed me to say how useful and how valuable they've been over the time. So I think that as well as we do the work internally, I don't necessarily think we promote it externally to the degree that people have find it useful. And I think you know what you've just said about having more technical 10 talks in the future, that's responding to what staff are telling us. And I think that we don't tell enough people externally about that. And I think a lot of work has gone on and a lot of people are really benefiting from it and getting enthused by it. And I think that, you know, I'm going to take this opportunity to thank you, but to just let people know externally that they're, you know, people within the organisation value being listened to, and also being given information and being able to find out what other people in the organisation are doing around that as well. So, Jock and Val, thank you very much. I just wanted to make those comments.
Thank you, Marilyn. We'll take a few, Chris, and come back to you. There's Marion and then Sam. Paul.
Thank you, Chair. And could I echo the positive comments that we've heard during the past few minutes? It's really been encouraging to see the work maturing and strengthening over the past year. What's clear to me is that there's a great relationship between the engagement team and the communications team, and seeing everything coming together really, really is a pleasure. On a personal note, in terms of the Welsh language, earlier this morning, we approved the annual report of More Than Just Words. And I think it's worth congratulating the team on the work that's taken place over the past year in terms of strengthening our bilingual messaging, and our presence has matured. It's not simply just translation anymore. We are seeing adaptation and effective communication, I think, in both languages. And so I just want to congratulate the team for this important work in this regard. Thank you.
Thank you, Marion. Sam Hall. I've got both Sams coming in, so Sam Hall.
Thank you, Chair. Just want to say again, thank you. But there's two things which have really struck me recently with communications and how it was really, I think someone's already mentioned, matured. And that's in two areas. And the first one is the support we get from the communications team when things are difficult. We've had some really challenging situations that have come up operationally that we've needed very, very quick support from the communications team to help us get that information as clear and as professional as we possibly can. And they have really stood up to that challenge in quite technical space as well. And that's been so invaluable to my teams that have been faced with some of those challenges, to have that real kind of professional sense added to some of the what can often be quite technical and a little bit grey information. So that's been great. But then also from a more of a personal note, having someone from the communications team come to our leadership teams meetings monthly with my leadership team to actually identify things that we will have missed for communication, really important things that actually we should be telling people about, or we should be promoting in some way, because good work happens all the time. It's going on daily in this organization, and we forget it because we're doing it all the time. And to have someone there from the comms team that says, hang on a minute, this is wider, we should be talking about this much wider than that, because it has implications and it has an impact for more people. They pick up the things we miss, and I think that's hugely valuable for all of us. So again, a big thank you back to the team.
Thank you, Sam. I'm not sure, is it Ridian or is it Ivan? Ridian.
Thank you. Yes, really welcome this. I think there are a couple of things I wanted to highlight. One is the fact that engaging with clinical staff, trying to work out how our products support our users. And I think that's a very important part of what we're here to do. The other thing is investing in skills and tools internally so that we can show what our products do by creating short videos and demonstrations of functionality that we've already invested in across the service, that we need to maximize the return on that investment by first of all promoting that functionality and then making it easier for our clinical community to find it and do it. Thanks. Okay,
and finally, before I come back to you, Chris, Sam Lloyd.
Thank you, Chair. I just wanted to add in response to David's question about recruitment, just to say that I've been doing quite a lot of recruitment recently as part of our transition to the new operating model, and talking to recruitees and asking them, or applicants, and asking them why they want to come and work for us. People universally say, they see what we do, they believe in it, they understand our mission, they want to be part of it. And I think that really speaks to the external presence that we have and the strength of our brand and the positive messaging, which is a lot down to the comms team and the work that's done and the different channels that we go out across. So I think it's effective in that space.
Thank you, Sam. I mean, a lot of appreciation there, Chris, for the work that the team is doing and the great strides that have been made in what is still quite a relatively short period of time. But are there any points you wanted to pick up on, any of the comments and any concluding remarks?
Just a couple, thank you, Chair. So just to add my thanks to the team, I know some of them are supporting the board meeting today. They are excellent, and they've been excellent over the last year and making some really good inroads into delivering the strategy. So it's all down to them, and I really appreciate all the work. I think the point around the engagement team and the links that have been forged there, they do work really well in partnership, and that is critical for us. And I think sharing some of the intelligence that takes place on a daily, weekly basis continues to be really important. I do just want to thank Ivan and Marion for their support as our board champions for the Welsh language. We have made some really big strides within the communications team. We've had a number of workshops to understand how we can best deliver content bilingually, and Marion and Ivan always push us to make sure we do the best we can. So I appreciate that. In terms of engaging with clinical staff, I think Rydian makes a really important point. The comms team have had a number of visits to a number of clinical sites, but I think that's something as an organisation that I'm really keen to push. That link and the understanding. It's hard for us because of the organisation we are. We don't have access without working in partnership to go and do some of that stuff. But wherever we can make the links and then promote the products via use cases and through talking with partners, I think that's really important. Those were the only comments, Simon, I wanted to make. Thank you.
Thank you, Chris, and I'm sure you'll pass on the appreciation that many have expressed around the table today to the team. And as I say, there's two of them out there who wave at me madly if I fail to go on unmute and keep me on the straight and narrow. So thanks to the whole team for, as I said earlier, fantastic work done in a relatively short period of time. We're running a little bit ahead of schedule, which is nice. So I think before we break, we'll take the next item and then break after that. And as item 5.3, building our future program update, and that's going to be introduced by Claire, the Exec Director of Finance. Over to you, Claire.
Diolch, Chair. Good morning, bore da. I'm going to take you through about 10 slides now that are going to, I hope, bring to life building our future, which is DHCW's transformational program that will really, I think, underpin our purpose, which I love, which is making digital a force for good in health and care. Normally, as Mission 5 leader, which is really about developing a strategic trusted partner, I lead all the enablers, all the glue that sticks DHCW together to really make our services, our services that deliver digital products shine. And what do those enablers consist of? And they're really broad, and they consist of not just finance, but commercial, people in OD, engagement, corporate services, and so on. So within that portfolio of enablers, we're really going to focus and centre our objectives over the next 12 months in really delivering our building a future. So given the ambitions in missions 1 to 4, which include things like moving to cloud, moving to a product-based delivery model, this year we thought mission 5 should really focus its attention on supporting and enabling those transformations and knit them together. And we're knitting them together under this frame of building our future. So I'm going to move on to the next slide, which really tries to outline what we're trying to do. So as I said, our purpose in DHCW is making digital a force for good. And as Ivan really eloquently laid out in our strategy, it's really made up of 5 key principles. So not one for nicking a good idea. I'm framing the programme around those 5 principles to bring them to life. And really the most important one of those is putting our people first. And that's really about enabling and energizing our workforce to understand what the new operating model is and how that will change over the next couple of years, and give them the ability to help frame that, but also to equip them with the right skills, the right toolkit, and the right capabilities, so that we work together and enhance DHCW's operating model in a way that will enable us to really deliver on what we need to do going forward. But it's not just about the people, it's also about the way we do things. It's not just about our behaviours, but it's creating that right environment to help us thrive at DHCW and create innovation as we go through that process. It's also about enabling the operational teams and strategic teams to deliver their new operating models and deliver their products, but it's to do so in the way that maximizes the value. So it's also about how we develop the most efficient and effective ways of doing it and demonstrate the value and benefits that all brings. So not an undemanding requirement, but if we move on to the next slide. So what we've been doing is trying to define what that means in this programme. So the key to it is really to try and fuel our innovative culture to embrace this new operating model and way of working with a product-based cloud delivery. And to do that, we need to equip our teams with the necessary toolkit, or as I've already alluded to, but also to build an academy, and we might change that word. It sounds very formal. I know we've had learning zone and various other options, but it's really a gateway to enable people to access learning tools and support to really enhance the sort of digital data and technology skills that we will need going forward. And to do that, we will need to coordinate all these activities and create an overarching plan that aligns to what we're trying to achieve in Mission 1 and 4. So important in that is understanding the timelines and the critical path and how, as enablers, we support that process. So to do that, we've created 5 work streams, which I'll show you in a bit more detail in a moment. But also underpinning that, understanding our value as an organisation, we will have a requirement to deliver financial savings in terms of efficiencies. And again, the plan will incorporate that into its requirements. So this programme will be overseen by the Portfolio Oversight Group as part of the Management Board, and it will be governed by the executive team as a committee, and I'll show you the structure later on. So building our future is there to enhance what we're going to achieve in Missions 1 and 4 and enable it and to align and knit together what we need to do in a more efficient and effective way. So if we move on to the next slide. So what have we done to date? So we've laid out what we're trying to achieve. We've also looked at how we deploy the programme, how it should be structured, and how what other additional dynamics we need to bring in terms of resources. And work to date is really focused on understanding that new operating model, looking at what that would mean for our architecture and our contractual requirements, and really trying to define what that critical path will look like in line with those 2 requirements going forward. We've already identified some areas of efficiency, but we're also focusing on really trying to define our future capability requirement, not just in terms of architecture, but also in terms of people, and then look at how our roadmap, how that will influence our roadmap. We've got a small team supported by Ali Smith, But again, the next steps moving on from that is to finalise that operating model and really to really establish the programme team and scope and start motoring on in terms of its deliverables. So if we just move to the next slide. Okay, so as part of this process, we're really looking also to define not just our quantitative, but our qualitative drivers. And again, we're leveraging the descriptions and the analysis brought in through our strategy. But again, we've also defined as part of our AMTP some of those quantitative drivers already, including our carbon footprint and also our financial benefits. So some of those are already defined and some of them are currently being more accurately and more detailed value propositions behind. Okay, if we move on to the next slide. In terms of governance then, we will, as I will be the executive sponsor for the programme, it'll report into the programme board via the portfolio board and be overseen by the executive directors. We're building up a transformational team made up obviously of support from various departments, and it will be focused in around 5 key project areas linking into that, the strategic purposes. But as you can see, putting people first actually is split into 2. But it will focus on putting people first, simplifying what we do in terms of our processes, design for more digital and data, finding more value, which will really focus on the financial aspects, and also about embracing the future. So if we move on to the next slide. So progress to date, we've met and agreed, we've taken this to the DHCW management board, and we also took it through a board development session with the IMs in April, which really underlined what I've just shown you, which is our sort of purpose, scope and objectives. We are focused on our priority, which is putting people first, and already we've been doing quite a bit of work in this area, defining job families. SJ has established a strategic workforce plan, and we've also identified some of the key critical paths within the first 4 missions and the resource requirement to support that. We've also looked at our digital academy, working on and looking at learnings from the financial academy, which will host the materials and training to enable personal development. And we're also looking at options as how we bring that to life. In addition, the corporate team have been looking at our corporate footprint, looking at our offices and looking at the ability to create an innovation hub, which will include not only a new type working environment, but we'll also look at how we bring those learning skills together, and also using our new tools and user-centered design to bring to life and then really trying to bring to life that digital experience for our staff and for our stakeholders. So engagement has started, and we're all looking forward to the forthcoming staff conference where we will further communicate details around the programme. Okay, so if we move to the next slide. So this one really tries to bring together the bridge of where we are now, the current DHCW and the future DHCW, and to show where the programme sits in really trying to define what it is that we need to do, how are we going to do that through the projects, the critical enablers, which is really the team, and we're now trying to really formulate what the outcome measures would look like as part linked to the strategy document that we did earlier this year. Okay, and then moving on to the last one then, which really details, and I won't go through this in great detail, what's the makeup of the projects that support the programme, with the work streams underpin that, some of the intended outcomes that we expect to achieve as part of those different project streams. So finally then, building our future next steps. So we now are looking to agree the programme work stream and owners to create and finalise the value creation statements, which really try to articulate where the value we will create move into our new organisational structure. We are finalising our product and architectural approaches. We've spent quite a lot of work in the past quarter looking at the capabilities and the requirements of each. And again, aligning the pod or the people in OD requirements to support those changes going forward. I'm really keen that we start the Digital Academy and bring the learning materials to life. And I know there's already some work in that area. And I'm really excited working with Sam Hall on developing a user-centered design and an innovation hub, again, with Chris in bringing those together to really create that innovation hub within DHCW. We're working on a communications and an engagement plan. And again, as part of the staff conference, we will look to engage staff more widely in the programme and its outcomes. So, Chair, this is the summary of the progress to date. I was hoping you would note the report, but also support me in building our future together as DHCW.
Thank you, Claire. I've got a couple of people want to come in, David and then Helen.
Thanks, Simon. Thanks, Claire. I fully support what you're doing. It's ambitious and there's a lot in it, but it's all essential to take us from where we are today to where we need to be. So I'm fully behind it. I've got two questions, if I may. So with regard to the product and architecture approaches, are we intending to map out our existing landscape, a lot of technical debt around the place, and then sort of sentence it in terms of what we would like it to be in the future, work out what we think is best delivered through COTS platforms, what we would need to develop as a product from an organizational perspective, and there are probably some bits in between which are sort of applications which aren't products but still need to be done. So is that part of what you're trying to do as part of that bit of the work stream? And then the second question was, you alluded to £5 million of value per year. Is that savings we're trying to make, or is that the value delivered by some of the product and capability we're delivering into the health boards?
Great, thank you. Shall I answer that, Chair? Yeah. So in terms of where we are now and where we're going to in terms of simplifying the architecture, a lot of that work is done in Mission 1 to 4. So they will articulate what the new, how our new architecture will look like, what our ambition is. And we have already mapped out our current state in relation to the HIMSS and assessment that we've done. So we've got a good understanding, I think, at this point of what our current architecture looks like and its strengths and weaknesses. We're in the process of defining what that new architecture will look like. But we, as part of the programme, we will support that process and understand from a couple of levels, what does that mean in terms of commercial requirements? So by simplifying our architecture, there's going to be a simplification, I would hope, of the commercial requirements underpinning that and the impact that will be in terms of our licenses. That would obviously create some value. It would also look at, with that new architecture, what does the skills requirement mean in terms of supporting that, and what does the corresponding training requirements using the DDAT, or the digital data and technology classification will be. So there is already a piece of work looking at what our new organizational structure underpinning that architecture looks like and what are the skills to do that. So we won't be doing the groundwork, David, but what we would do is coordinate and support the delivery of that by understanding that roadmap and the resource requirements from the enabling, such as commercial, such as pod, to ensure that, and also such as finance, because we would hope to moving on to your second question, is there inevitably, I would hope, be some savings, cost savings as a result of that change in architecture. However, that move to that new architecture is going to have a cost implication. So it is about balancing that out and understanding that and do the numbers. The 5 million is actually the 3-year IMTP savings requirement that we would have to deliver anyway. And so there is a financial driver for that. But actually, this program is about creating value. So for me, this is about demonstrating the engine room of digital and the value it can unlock, not just from a DHCW perspective of being simplified, more efficient and effective, but also from a national perspective of our ability to use those skills to really leverage the other 4 missions. So that's what we're hoping to achieve.
Thank you, Claire.
Thank you, Claire. Helen, and then Andrew.
Yeah, thank you, and thank you, Claire. I just wanted to kind of reinforce the message. I'm really pleased to see this coming to the board to talk about this work and to give it the status that it needs, so that we have at an organisation level that kind of system-wide view of all of the change, really, as we move into developing the organisation to actually be able to grow and learn and respond to the kind of the pace of change that we find in the digital data and technology world. So this gives us that the line of sight and the overview as an executive team, and that actually none of these changes that are happening can happen in isolation. As Claire points out, we need a whole system, a whole organisation approach to this. So I suppose it's just to and reassure our staff out there, really, in terms of this isn't change for change's sake. This is change to kind of make us more agile, make us more resilient as an organisation, more responsive, and to make sure that we are organised and also developing and constantly developing our skills and our knowledge in a way that we need to ensure that we are delivering to the best that we can, and therefore realizing value that digital can bring, and that, you know, digital is the thing that is going to underpin transformation across the NHS and support the sustainability of the whole kind of cause for the NHS. So this is about us getting our house in order, really, and making sure that we're set up for the challenge and to grow along with kind of the pace of change that we need. So yeah, really pleased to see that come into the board today. So thank you.
Andrew.
Just a quick comment for me, really, just to say that how pleasing it is to see the good work that's being done, and I'm particularly pleased in relation to the staff engagement. I know we've there's a lot of good staff engagement going on around this, and it's not just about that; it's about development of staff, to develop staff. So that we can take forward the future of DHCW, and just really to publicly offer any support that we can give where we can. I know we're involved in little bits of it here and there already, but yeah, here to help where we can.
Thanks, Andrew. I'll come back to you at the end, Claire. Marilyn.
I just wanted to echo, thank you, Chair. I want to echo what Andrew said. Thank you very much, Jochen Bauer and Claire. Some fantastic work, and I think it's very innovative. And I think that putting people first is obviously the most important thing, and giving people opportunities to reflect and use their skills and experience to further the organisation is only going to be beneficial to both the organisation and to any individuals who want to get involved. So I just wanted to sort of, give my offer of support, as Andrew has as well, within the project. If there's anything I can do, I'd be really keen to be involved.
Thank you, Marilyn. Just before you come in, Claire, I mean, it's obviously a transformational piece of work, this, and will impact on the entirety of the organisation and how we do things, how well we do things, how efficiently we do things, and obviously impact on the future of staff as well, in one very much hopes in a positive way and a supportive way. And as a result, I'm thinking, well, what sort of future reporting do you want to bring back to the board, or do we think is appropriate to bring back to the board on the progress of this program, given its transformative nature? The board is obviously going to want to be aware of and be assured of the progress and the impact it's making. Helen, any thoughts?
Yeah, so the first things first is this is a programme that will be set up and have oversight through the portfolio oversight route, and then could then go through to the programme delivery.
Okay.
Part of our routine reporting, but I think we'd welcome bringing it as a substantive agenda item, as frequently as the board would wish, really, but it will definitely be available through our normal kind of programme reporting arrangements.
I mean, that's great, and that through that committee makes all sorts of sense and I've got this. 6 months is rattling around in my head that we ought to have a sort of a board substantive agenda item on it on a 6 monthly basis, given the impact it's going to have on the organisation. I don't think that sounds too much, and it doesn't sound too little, if you get my drift.
Yeah, great. Happy to do that.
Claire, did you want to come back in before you are keeping us from the break, but
no pressure there then. No, I'm really excited by it, and Marion comments, and Andrew, I will gladly grab your hands and bring you with us on this journey, because it is a journey that we're going on. And I'm really excited by the opportunities it will bring for the DHCW team to really be innovative and come with us on delivering our new operating model, which will enhance the way we deliver services and actually really lead to that purpose, which is making digital a force for good in health and care, which we all passionately believe in. So yeah, I'm looking forward to showing the progress over the next couple of months on the delivery of it. So thank you, Chair.
Thank you very much, Claire, and please do, as ever, pass on our thanks to all those who have been involved and supported you in this supporting you in this work. We're still running a little bit ahead of schedule, which again is a good thing. We'll take a break now, and we'll reconvene at 11:30. So if you could remember to turn your cameras and mute, please, and see you again at 11:30. Thank you. Welcome back, everyone. Thank you for coming back on time. If we move on to the next section of the agenda, governance, risk, performance and assurance, and item 6.1, and invite Claire to introduce the finance report. Over to you again, Claire.
Right then, okay, if we pull the slides up, I'll take you through the performance report as at the end of April. So if we move to the next slide, I'll touch on briefly on the last financial year and where we are in terms of the process, and then I'll kick us off into the start of a new financial year, our fourth year, so it's flying. But so I'll take you through the key highlights of our current financial performance and some of the issues and some of the opportunities that arise in that. So if you move us on kindly to the next slide. Okay, so what I'm going to demonstrate here is the financial performance as at the end of April against our current budgets. It will focus on our core services, which include primary care and the national immunisation requirements, which is funded by Welsh Government and the NHS organisations, but also we'll touch on the Welsh Government's Digital Priorities Investment Fund allocations and where we are. And this is really to line us up for what I'll touch on in a minute, which is the annual statutory account. So it's a building block towards that. If you move us on to the next slide, please. Okay, reflecting on last year's performance, if you move to the next slide, this table summarises where we are in terms of our statutory requirements. So as you're aware, as a board, we have to ensure we break even for both revenue and capital. We have a public sector payment policy that ensures that we have to pay within 30 days, and we have a cash balance, which is always a fine art, which we have a requirement to balance within 2 million at the year end. And as you can see, as at the year end, we achieved all our requirements. We ended the year 292,000 underspent. That's based on over £168 million spend. Our capital, we spent 17.8 million, and again we did that within 17k. Our payment was outturned at 97%, which is above our target of 95, although it fell slightly towards the end of the year. And then our cash balances decreased by 2.9 million to land the year at our target of 2 million. So I'm delighted with the effort the finance team put in to achieve that. And we've currently got the auditors coming in to go through the balances and checks as part of the requirements, the governance requirements, which takes me on to the next slide, actually. So if you move us on. So where are we in terms of the annual accounts and timelines? So we're halfway there. If you look at it from the slides, we've prepared, we've drafted, and we've done our internal review. That was undertaken by the Audit and Assurance Committee in May. We are now looking to complete the full, which we call ISA 260 report, all the details around the transactions in DHCW and the assumptions. And we're looking to complete that so that it can go to approval for the audit and the board to be finalised, to be honest, around the beginning of May, so that they can all sign, sealed and be delivered to Welsh Government at the end of July. Sorry, it would be the beginning of July and then signed to Welsh Government at the end. So quite a lot of work going on with the teams, with Welsh Audit Office to complete and fulfil those requirements. So all looking good there. So if you move on to the next slide, I will then take you into this financial year and give you a summary of the performance as at the end of April. So of course, beginning of the year, what we've done is delegated our budgets down through the organisation to budget holders. So those of you watching have had a letter from us setting out your delegated responsibilities for the year ahead. And what we'll show you is, you can see the run rates that we are now forecasting as a result of those budget allocations. The other things to note is that we have been given a budget allocation, which we're going to be badged going forward into the vaccine requirements. But we will see at the end of Q1 the conclusion really of the track and trace and protect, test, trace and protect, so you go, sorry, funding. We've also got our savings plan. So we've got £1.5 million worth of savings that we have to achieve, and I'll show you where we are against that already. We are currently going through quite a detailed exercise internally with all the health boards and trusts, because it's that time of year, the Office 365 contract payment. So again, we are now looking to meet that objective by the end of the end of June, so that we can fulfill the year 3 of that contract. And also in relation to the DPIF. So if you remember, we had a planning assumption in relation to our DPIF allocation from this year, which was a control total of 28. Again, we're working with Welsh Government to finalise that allocation, but a lot of activity, and I'll show you some details around where we are with that. And then some good news, our discretionary capital allocation for this year has increased by 355,000. So it's back up to the 2.9 million. And again, we've got plans in place to allocate and spend that money. And we're just waiting on the final allocation associated with DPIF in relation to capital. It's not without its risks, though. We are seeing within DHCW increases around supplier licensing costs and prices. So as we're taking a real national leadership role in this space to try and mitigate some of those cost pressures. So again, just for your awareness, we are, unlike the general economy, we're not seeing a slowdown in inflation. We're actually still seeing some digital pricing inflation. So if you move on to the next slide. So in terms of our summary of our financial position, this should actually say 24-25 at the top. In terms of our position as at the end of April, our revenue was slightly underspent in the month of 96. Capital, again, we were reporting a spend of 242, and I'll show you that. Our PSPP's target had gone back up to 98 against a target of 95, and our cash balances are currently at 4.2 million. Like I said, given that we will be settling the Microsoft, we will see our cash balances move significantly in the next couple of months. That will be, and then come back down in July. So just for your awareness there. If you move on to the next slide, then, if you look at our revenue performance in relation to our directorates, you can see most directorates were underspent, and you'll start to see that in our savings plan in April, the impact of that. But there are some cost pressures. Operations are showing slight increase in spend, and this is really reflecting some of the work that we're doing in the data center, which is front-end loaded and actually a sort of hangover from last year. And also workforce and OD. We've undertaken some additional resources in that area that, again, during the year will be flexed, and you should see that come back in line towards the middle of the year. Okay, if we move us on to the next slide. Okay, so I talked about the run rate. So based on our budget allocation, you can see this chart shows you the spend rate in both pay and non-pay for the rest of the year, and the red box is obviously where we are today. As you notice, there is some fluctuation throughout the year, particularly in the light blue, which is our non-pay allocation, and that really reflects the impact of the assumptions around some of the digital priorities investment funds. But again, we'll monitor that throughout the year. But in the first month, we've actually spent £13.5 million. Okay, if you move us on to the next slide. So as you're aware, we've been given a control total currently around our digital priorities investment fund for the year. So that's just over 28 million. This actually breaks down that spend by programme, but it also includes some of the funding from NHS organisations, particularly in LIMS and RISP, which shows that our DPIF allocations in total for DHCW is just shy of 30 million for the year. Activity during the month was quite high, actually in line with expectations. If you divide 28 into quarters, you've got 7 million, and if you divide it by months, we're broadly in line with that at 2.3 million. The big players in that were the app spend. We spent quite some money in the month in relation to the DSPP developments, and equally in the NDR. And again, the NDR is predominantly pay related, albeit we did spend some money on the Google Cloud. So again, we are then forecasting to the end of year a further spend of around about 27.3 million. Okay, so move us on to the next slide. I talked about the increase in capital, which is the top left-hand corner, the 29.69 for this year. Again, most of that will be spent in the infrastructure and an IT environment. And again, we're working alongside Sam Lloyd and his team to understand the requirements in this area. And again, we'll report on that as it progresses throughout the year. And as I alluded to in the Build the Future, Chris is working on some estates work that, again, you'll see come alive in the next couple of weeks and months. And that is also included in our plan. And the balance relates to the DPIF related spend, and you can see is dominated by the link and risk programs in the forthcoming year. Okay, if you'd like to move us on. Okay, so this slide breaks down our savings requirements and projections. And as the first slide showed, the spend by directorates, you can see already in the first year that we've exceeded expectations in terms of savings, predominantly around the vacancy factor. So we've delivered 263k more than we anticipated in our plan. And again, together with SJ and the strategic resourcing group, we are looking to provide support to the workforce requirements. So I know Sam Hall, particularly in the first quarter, will be spending some money to support some of the work that she's doing in the vaccine and other areas. So again, savings plan is slightly ahead of plan in the first month. So if you move us on to the next one, just to reinforce, if I have the opportunity, of course, you can't over communicate. We are working on building the future. And within that, there is a section of program called Finding More Value. So again, as part of our longer term plan, we are looking at what efficiencies we can drive within the finance and develop as we go. And then finally, if we move on to the next slide. Then in terms of risk, again, at this point in time, there's really only two I wanted to raise. One is, as I already mentioned, we are still seeing quite a high level of digital inflation. Again, using our national leadership with the commercial teams, we are looking to minimise that for the NHS in Wales, and we're working alongside some of our suppliers to mitigate some of those cost pressures, but it remains on our radar as a risk. And again, relating to the DPIF programme funding, whilst we have a controlled total until we get final formal communication from Welsh Government, obviously that still remains a risk. And then, like all things, there are opportunities. We are working alongside Welsh Government on a sustainable funding, looking at how we transition some of our programmes and what that means for DHCW. I hate saying this one because I know Simon's going to read it anyway, but the VAT recovery for Microsoft, we are still working our way with the HMRC holding our hands. It's gone to their internal policy team, but I know Welsh Government are working with us to understand what our position is on that going forward. And finally, I presented to you alongside our short-term initiatives and our efficiencies, we are looking at what our finding more value will mean for our longer term building our future. So our final slide then is to say, please, I would be grateful if you note where we are in terms of the pre-audit results for 23-24 and the annual account delivery timeline, but also to note the financial position as at the first month of the year and the forecast that we will achieve our targets for 2024-25. Thank you, Chair.
Thanks, Claire. Can I just ask one question? You had a date for the board sign off of the annual accounts, which I think was the 9th of July. But the board meeting in July is the 20-something, the 25th. Will be that be the meeting it comes to? Does that allow enough time?
Yeah, if you notice, I put to be confirmed. You're right. At the time that the slides were done, we were looking to see if we would do it before that. That would still be in time for the 31st of July requirement for Welsh Government.
Thank you, David.
Thanks, Simon. Thanks, Claire. Very clear as always. I've got two questions. First, around the savings, which are largely coming from vacancies. We've seen through the DPIF budget allocation some reduction in spend on some of our programs, which propped up at the Programme Delivery Committee. Can you sort of speak to whether we've got whether those things match out? So we've got vacancies, but we've also got programs that are slowing down. Are those two things matching, or have we got a mismatch between where the vacancies sit and the programs that are currently reducing their spend? As first question. And the second one is, given the general sense of everything's a bit tight this year, likely to be tight next year, our opportunity to get to a sustainable funding model, have you got, how much confidence have we got that we'll be able to sort of break the logjam and get to a position where we've got the required funding to deliver more value into the system?
Yeah, okay, so I'll take the first one then. So the DPIF reductions are already built into our budget allocation. So the 6 million, I think it was in DPIF, is already, the 28 million is what the budgets that we've delegated to. In terms of the level of savings, does it correlate? Actually, it's mixed. There are some key vacancies within the core allocation that we are looking to recruit to, and we have plans to do that. So that's in progress. There are some vacancies in the DPIF allocation, but together with Ivan, we're working through how to optimise our funded position within those programmes. But the allocation that we got from Welsh Government was such that it would cover all current vacancy, all current committed spend in the pay area. So that covers that, I hope. In terms of the sustainable funding position, there's a couple of things here. There is a question about what does the new operating model for DHCW look like, and what does that cost mean, which we are working through as part of that, finding our value as to, once we know what the new architecture looks like and the new operating structure, what does that cost out and mean? And is it cost neutral? Is there cost reduction or cost pressure? So we're working on that. The other bit is in relation to the programs that are in the pipeline. And that's more about how do we support those for their total life? That's the piece of work where we've done a couple of business cases to equate what does translating those programs into products, in effect, what does that look like, and what's those funding arrangements? And we are in the process of finalising some of those business cases to present to Welsh Government, and then we'll have a stronger idea as to their appetite or ability, or to do, if I'm honest, to fund that. But to do that, we also have to demonstrate the value those digital programs are generating. And to be fair, together with Ivan and the team and the programs office, they've done a very detailed piece of work alongside that, which shows the value and difference those programs are making. So that's another piece of work that we are in progress. And at some point, I'm sure we'll share that with the board.
Thank you, Claire.
Thank you, Claire. I think that must be Ivan with his hand up. Is it, Ivan?
It is. It is. Thank you, Simon. Yeah, I was just going to come back and comment on David's question about are the savings aligned with the vacancies that we have within the programs? Broadly, yes, because many of those vacancies were about a program moving to a different phase because it was going to accelerate rollout, or it was going to take on additional responsibilities because it was moving into a new stage. So in that regard, the savings or the reduced funding envelope is quite easy to achieve by not recruiting those people that we were intending to recruit. Obviously, what that means then is that we can't do the things, we haven't got the people to do the things that we were intending to do within that program. And so all of the programs are now going through a process of looking very carefully at the resources that they've got and looking at whether we can move people into different roles in order to shift the program into the new mode that it wants to be in, because programs evolve all the time. And that is not always easy, because sometimes the skills that you have for what you're doing at the moment are not the same skills for what you want to do in the next stage. So the programs are also working closely through the Portfolio Management Office to look at opportunities for, swapping people or moving people around, because phases are all, different programs are at different phases in their life. And this is quite, it's a new thing, because programs historically have been quite self-contained and quite independent. They've often had slightly different governance and phasing arrangements. And that's part of what we've been wanting to do or what we've started doing since we established the PMO 6 months ago. So, as you know, I'm always glass half full, and every cloud has got a silver lining, and never let a crisis go to waste. So, it's a discipline that we want to be applying across programs anyway. There is a lot of work to do, and I'm really keen to maintain the role of program boards in all of this, so that we're not jumping over or short-circuiting the really important governance function of program boards as part of a portfolio approach. So the next stage, which I'll give a brief update on in my next item on IMTP when that comes up, is the work that's going on within programs to reprofile their resources and their plans and their delivery priorities and various other things, and then that plays back into the wider portfolio and DHCW.
David, you wanted to come back in?
Yes, please. To Claire on the sustainable funding. One of the things that we were doing was getting some external help to look at the level of spend on IT and digital in the NHS in Wales and benchmark it. Have we seen anything back from that exercise yet?
So we are validating the numbers with the other NHS organisations in Scotland in particular, where there seemed to be a bit of a data issue. But once we've got that and we validate it, I'd be happy to share that more widely.
Thank you.
Is that the HFMA piece of work, is it, Claire? Okay.
Yeah, that's right, yeah.
I don't see any other hands up. So, Claire, thank you very much, as ever, for your very clear report. And we've been asked to receive that report, and we will do so. If we move on to the next item then, which is the Corporate Risk Register and Board Assurance Framework Report on Annual Review of Risk Appetite and Risk Tolerance, which we had a very useful session on, as was mentioned earlier in the last board development session. So I'm going to invite Chris to introduce this item. Chris.
Thank you, Chair. Yeah, as you say, this item does cover a couple of things. So I'm going to run through the current risk register position, our risk profile. We're then going to look at the board assurance report end of year position for 2023-24. And then I'll run through our risk appetite for approval by the board for 24-25. So I'm just going to start by looking at our current risk position. So DHCW has 17 risks on the corporate risk register, 12 of which are detailed in the papers today. They're all marked as public risks. There are 5 private risks. 4 of those we scrutinised through the Digital Governance and Safety Committee in private session, and 1 was considered earlier this month in the Programmes Delivery Committee. So since the last board meeting, there's been 1 new risk added to the risk register, no risks removed and no changes to risk scores. So I'm asking board members to note the new risk, which is DHCW 0335, Service Catalogue Agile Process. And I'm going to ask in a moment Sam Lloyd just to comment on that one, as he's the exec lead for that. There's 2 others that I did want to bring to the board's attention. So after Sam's commented on that, which was 0332 Sustainable Programme Funding. The last item, Evan, might have covered that. But I'll see if you want to update on that, because that was a key area we discussed at the last board meeting. And finally, 0333, the WICIS Intensive Care Implementation Delay Risk. So Sam, can I start with you on the new risk, please?
Yep, thank you, Chris. So as Chris says, this is a new risk regarding the agility of our service catalogue and the processes that we have in place to keep that up to date. So our service estate is complex. It's a mixture of new services and some that have been inherited from other parts of the system, some that were built by ourselves in previous incarnations of the organisation, some that were built by predecessor organisations, some were built by health boards and we host. So the service catalogue is critical as it defines the support model and the life cycle of the services that we operate. And as services develop and pass through that life cycle, then their support requirements can change. So over time, a service can become more or less critical, and that's not always visible unless those changes are reflected in the service catalogue. We've potentially got a lot of service changes coming up as we look to retire legacy services. We modernise core parts of our architecture. We're rapidly building some new services such as the Dental Access Portal, which have got the potential to quickly become critical. So we have to ensure that the service catalogue and our management of it is sufficiently agile to reflect those changes and that rapidly moving life cycle of services to ensure that we've got the right support arrangements in place, essentially.
Thank you, Sam. Chair, shall I just pause to see if there's questions?
Yeah, I think yeah, we'll take it in blocks as much. It seems to make sense. So, are there any questions or comments on that one? If not, move on, Chris. And then when you've completed the risk register bit, we'll sign that off as a board and then move on to the next bit. Yeah.
Perfect. Thanks. So thanks, Chair. Ivan, do you want to comment on the 2 risks identified for updates for the board?
Certainly, thanks, Chris. So the first update is on funding, and it's phrased as future years funding. Technically, the position is that no programs have certainty of funding beyond March of next year, and that goes for most activity across the NHS because of the Welsh Government's budget position. So we're working very closely with Welsh Government, as you might imagine, on this year's funding arrangement and position for the DPIF programmes, which again is not yet formally confirmed, but we've got a close engagement and a close, and a good understanding of where we sit with Welsh Government, as Claire has just covered, and all parties are fully aware of the position and the pressures that we have, and the need for us to start doing some real mitigation options within a quarter or 2, I think, sort of September time, if we feel that there's a materializing uncertainty, let's call it, about our future funding position. But we've still got a reasonable confidence of where we're headed. As I think Claire has mentioned previously, we've just submitted the DSPP business case, which is from April of next year onwards. So we've got active discussions. So I feel as if there is a real risk there, and it's important that we recognise that risk. But there's a lot of active management work which is happening on that. And then the second risk is about the Welsh Intensive Care Information System implementation timetable. This is one of many risks that really arise from programmes and from national programmes, but we recognise all national programme risks in DATIX, which is the DHCW risk register, and so they appear in the DHCW risk register, and this is part of our commitment to transparency. Those risks are managed by programme boards as well, and programme boards in many cases will consist of ourselves and health board representatives. So they are, in some senses, they're system risks, but they appear in the DHCW risk register because we manage these programs, and on the basis of transparently reporting where we are, it's important that we do that. So the position on WCIS implementation is that we're in very, very close engagement with health boards across Wales, all the way up to chief executive level, and with Welsh Government at director level, in order to try to confirm the implementation timetable. There are pressures right across the whole system that are impacting prioritisation, as well as a very busy digital transformation programme. But it's very important that we land that implementation timetable so that we can confirm it and work collectively. But we have to do that on a collaborative basis. We have to do that on the basis of consent. There's no way that we can direct partners, nor that they can direct us. We're all working together as equal peer organisations in this. So it takes quite a bit of choreography, I would say. But this is another area where there's a lot of intense management and mitigation of this risk, but it's important that it's recognised in the register.
Thank you, Ivan. Should we pause there? Those are the big issues you wanted to cover, isn't it, in the risk? Should we pause there and people happy to note and receive the amended risk register? Yep. Thank you very much, Chris. On to your next bit.
Thank you, Chair. Yeah, if we I'm going to move on to some slides now, and the slides will cover 2 areas that I'll run through. The first is a review and an update on our Board Assurance Framework dashboard for 2023-24, the end of year position. I'm going to run through that myself, and then I'm going to invite exec leads to comment and add anything, because I am going to do it relatively quickly and potentially do a disservice to all the work they've done. So I don't want to do that. So I want to make sure they've got the opportunity to add to that. And then I'm going to move on to our 2024-25 risk appetite and tolerance position for approval by the board. And as you say, Simon, we did have a detailed conversation on this at the end of April at our board development session. So if we move on to the next slide. So this is just to confirm that this is a 2023-24 end of year position. And if we move to the next one, you can see that generally the actions and controls that we've identified and put in place are designed to try and reduce the likelihood of the principal risks from taking place, which will impact on our 5 strategic missions, which of course increases the opportunity to be successful in delivering the strategic missions. I think it's also worth just saying that the strategic missions, they are long-term. So every year we reassess, we reevaluate, and we put refreshed action plans. We review the controls and assurances in place, and then start again. So we've just done that bit of work whilst also finishing off the end of year position. So if we move to the next slide, this slide just shows a summary of the 5 strategic missions. So there's 5 corresponding principal risks. I'm not going to read each of them out because I know you've had the papers, but the assurance summary slide for 23-24 just shows the risk appetite position that we as a board signed off and agreed at the start of the 23-24 financial year, so just over a year ago. And that was to be cautious for strategic mission 1 and 2, moderate for strategic mission 3, open for strategic mission 4, and moderate for strategic mission 5. It also shows the final assessment. So on the far right-hand side, you can see that the executive lead has assessed the end of year position in terms of confidence in the controls and actions that have taken place over the course of the year. So the first 4 assurance self-assessment is amber, and strategic mission 5 is green. So I'm just going to run through now each of the areas, and as I say, I'm going to do this briefly, and then I'll invite executive leads to add any comments. So the next slide is strategic mission 1, which is to provide a platform for enabling digital transformation that has the corresponding principal risk, and the associated corporate risks are also documented. Ivan's the executive lead for this area. He's assessed this as amber. I'm just going to call out the code of conduct work and the consultation around the Welsh Accord for Sharing Personal Information. That was a huge bit of work through the last financial year that progressed us against this strategic mission and in mitigating the risk. But alongside that, we've got the corporate risk that board members will be familiar with around citizen and stakeholder trust in uses of health and care data, previously known as the data promise, and a lot of liaison continues on that. So I think that hasn't probably progressed quite as quickly as we would have liked organisationally. So those are the 2 areas I wanted just to pick out on this one. The next slide, strategic mission 2. So delivering high quality technical digital products and services. Sam Lloyd's the executive lead. He's rag scored this as amber. As mentioned earlier, a huge amount of engagement work, both in operations and in Sam Hall's area in primary community and mental health around the target operating model. So that's taking place over the last year, including a lot of work over the last 6 months in particular. And that's being incorporated into the Building Our Future programme. We've also had progress in link and RISP. I'm going to specifically mention those. There was an update given to the programme's delivery committee earlier this month, but also work which probably hasn't progressed as quickly again as we'd liked around eye care and the intensive care programme, as Ivan's just mentioned, and those risks linked to this strategic mission. The next slide, mission 3, expanding the digital health and care record and the use of digital to improve health and care. So Ivan's the exec lead. The amber end of year position is stated there. We have gone into public beta for the NHS Wales app during the last year. We've also put a lot of focus on user-centered design, and I think that's been illustrated with Sam Hall taking the executive lead role and establishing that function within the organisation. The API platform team's also been established and a roadmap developed. If we move on to the next slide, which is mission 4, so driving better value and outcomes through innovation. Ridian's the executive lead here. Ridian's assessed this as an amber end of year position. Going to reference the research and innovation governance that's been put in place and established over the last year, really important. The foundations have been laid, and we've also approved as a board the information and analytics strategy. And R&I, or research and innovation, is now a routine item with assurance provided to the Digital Governance and Safety Committee at each of their meetings. And the final strategic mission is Strategic Mission 5, to be the trusted strategic partner and high quality, inclusive and ambitious organisation. So Claire's the executive lead. This one's been RAG scored as green in terms of end of year position. We've responded to the NHS Wales financial challenges during the course of the year, having additional financial savings being placed on us as an organisation, and delivered those during this financial year. There's also been significant progress, I think, against the Digital Inclusion Charter and the action plan linked to that. And we have signed off and approved as a board our Wellbeing and Future Generations Act, our statement and our objectives, our wellbeing objectives. The PMO, as Ivan referenced earlier, has been established about 6 months ago, and the benefits framework progressed and developed. So I'm going to pause there before I move on to the 2024-25 risk appetite position, and just invite any of the executive leads to comment, because there is a lot that goes in to the BAF. There's a lot that sits behind this in terms of controls, actions and assurances. So I don't want to miss anything if there's anything pertinent that needs to be pulled out.
Okay, because slides are up, I can't see, I can only see 6 tiles. So you go on, Claire.
So as the only green, but I would say we had an awful lot of discussion on the rating around the RAG status with Mission 5, because it's so diverse in the level of activities, but also in the level of deliverables that we've done, from the financing to the pods, a lot of the pod policies and delivering, but equally on the sustainability front, the well-being front, the quality front, and the business continuity, and many more. So I think what I would say, that I know that when we review this as a team, Beth, who leads the risk analysis, pulls her hair out, because we have such a diverse range of opinions and views. So, but I do feel confident that the action plan and mitigations that we've done as a collective under Mission 5 would enable us to feel confident around the RAG rating. But I just want to say, you know, to assure the board really that reviewing our RAG rating and our deliverables is an interactive and an interesting debate in Mission 5, given its diversity. But they all were confident in the RAG rating that we finally agreed on.
Thank you, Claire. Ruth.
Thanks, Claire. I think Mission 5 is probably going to be the one that is most impacted by the Building Our Future programme. So really, I'm just interested in your reflections on how you're building the review from that, because I'd imagine that overall our risk appetite is going to be massively impacted as well as we move forwards through the programme. And I think, to note your comment, what none of this, amazing slides though they are, actually captures is the kind of depth of insight and the work that goes on underneath this across the teams, and then right up to board level where we have those discussions. So I think I just wanted to acknowledge that point as well. Thank you.
Thank you, Ruth. Do you want me to respond to that?
Go on, and then I'll bring Rowan in.
Yeah, so I think the Build the Future programme will actually pinpoint, because a lot of the actions and mitigations are planned. The Building Our Future programme is the delivery of those plans, and it will centre it around the organisation's purpose. So I think you're right. I think this will become more relevant, and actually we'll have a broader debate and the other missions validating our thinking in terms of some of the deliverables. Yeah, thanks, Ruth.
And Rowan. Oh, your sound is off, Rowan. It's weird. No. Something's amiss, Rowan. If you want to put your question in the chat quickly, I'll read it out. Oh, you need to mute yourself as well. That's better. Anyone else? Well, just wait a moment for Rowan to so I can pick it up. Okay, she says move on. Okay. Any other questions or comments? Okay, Chris, we need to receive this report, don't we? And then
yeah, Simon, just a couple of slides. I think Hannah took them down a few early just to
okay, sorry,
to allow that discussion and see the hand. So thank you, Hannah. The just going to recap, and board members will be familiar with some of this from the board development session, but the important for us that we just review and formally approve our risk appetite position going in to 24-25. So the next slide just shows our risk appetite statement. And I think the key point here is that we as a board have agreed that DHCW must take risks in order to achieve our objectives. So of course, if we must take risks, we need to be clear on some of the level of risk we're willing to take and ensure that guides some of our decision making. On the right, the diagram on the right on this slide just highlights where we're saying in our operational domains, we will be cautious, averse, moderate or open. We haven't got any domains that are hungry in terms of risk appetite, and hungry being that you essentially will take any and all risks. So we are adverse in terms of compliance, information storing and maintaining, and citizen safety, cautious around reputation, finance, safety and well-being, service delivery and information access and sharing, moderate around corporate social responsibility, and open in terms of development of our services. And the next slide just shows that in a slightly different way, with the articulated statement alongside it, which will help use to communicate the position around the operational domains. The next slide is our 2024-25 risk appetite position as they relate to our principal risks and strategic missions. And there is a change that you would have noted. So I'm just going to summarize some of the discussion from the board development day, because there was a lot of debate and engagement. So really constructive. We did get into use of terminology, with the consensus being to retain use of the word cautious. We talked about protect and whether that could be used. We talked about the environmental context and the changes that we've seen over the past 12 months and some of the changes that we're likely to see internally and externally over the next 12 to 24 months as an organisation, and how that might impact us, how that might impact our decision making and risk appetite, as Ruth mentioned earlier. We didn't make any changes to the or propose any changes to the operational domains, but we did and we did also talk at length around mission 5 and discuss the risk appetite for this mission. We ended up I think agreeing that it should remain at moderate to reflect the diversity of the mission, as Claire mentioned earlier, and that it does cover a number of things, and this is probably overall a balanced position, recognizing there will be nuance within it. Where we spent a fair bit of time though, where the change has taken place, we discussed the risk appetite relating to strategic mission 2, and this has changed from cautious as it was last financial year to moderate going into this financial year. So if approved by the board, this will be something that's different, and we would have to communicate that organisationally. The discussion was around ensuring that we're moderate to allow a willingness to move at pace with new products and services. But I will, Simon, if it's okay, just invite Sam Lloyd to comment on this. He is the strategic mission lead on this one, and I think has done some reflections on the risk appetite for this mission since the board development.
Okay, Sam. Thank you, Chris. Yeah, so mission 2 is around delivering high quality digital products and services. We've talked a bit this morning already about the needing to become more agile as an organisation and better able to react quickly to changing demands. We've also talked about our transition to a new operating model. And I think mission 2 is where some of those changes will start to really bear fruit, because this is where this is the engine room of our building of services. So changing this risk appetite in this space, I think, reflects our need to adapt and be prepared to move faster in the realm of building new services we know that we've got some legacy in this space, and we've talked about the architecture and the transformation plans that we've got there as well. So we need to be able to move faster, build new services more quickly, and effectively deliver value earlier, and that requires a slight change to our risk appetite. But just to be clear, this doesn't affect the way in which we'll be managing existing live services. We'll continue to obviously treat those as critical where necessary and manage them very carefully.
Thank you, Sam. So, Chair, that concludes the slides I wanted to go through. Just wanted to thank the board for the engagement at the last board development session on this topic. It is really important for us organisationally, and having that debate and challenge is really helpful for us. So I am asking the board to approve our risk appetite position for 2024-25. If approved, we will then do some proactive communication of that and of the changes across the organisation to ensure we try and embed it into the culture and try and make sure it affects and impacts the decisions and how we make decisions organisationally. Happy to take questions, Chair, but just to conclude on that.
I think we do also need to formally receive the BAF report, which we didn't do. So people happy to do that. Okay, any questions on the 24-25 risk appetite that we have had discussions on? Okay, and now we need to formally approve that. People happy to formally approve that? Great, thank you very much. We will take one more item before we break for lunch, I think, because again, we're a little bit ahead. And I have alerted Ivan. So it will take item 6.3, the IMTP 24-25 to 26-27 update. Ivan.
Thank you very much, Simon. So members will be familiar, I'm sure, with the IMTP. We had a detailed conversation on it in the last meeting as the board approved the IMTP for these years, for the next 3 years. And this report is up to the end of April, the first month. So there are only 3 things I want to draw to your attention in terms of what's taken place. The first is the formal process of our deliberations with Welsh Government. We've submitted the IMTP to Welsh Government. Government is then meeting formally with us, formally and informally, and they will be giving us feedback in due course on the IMTP. We had a meeting with Welsh Government last Friday actually. It was a positive and constructive meeting, I think. Over 30 people present from Welsh Government, so they bring policy leads from across the department into one meeting in order to discuss with us what is in our IMTP, and the basis of that, I think, forming the recommendations. There were 2 things that we guided them through. One of them was the way in which we manage the IMTP at an operational level, how we manage the milestones and how we look at the resources behind each milestone in order to show Welsh Government that we have a firm grasp down to that level on what is in the IMTP and how to move things around. The second thing was the importance or the need to prioritise within the resources we have. So Welsh Government gives us specific resources, and then through the IMTP we agree on what we're going to deliver against those resources. And what tends to happen in this process with Welsh Government, and I've been on both sides of that during my career, is that the policy leads will ask for more. They will want additional priorities, and they will want to see additional operation action and delivery. And we had a positive, constructive and honest conversation about the need to slow down or stop other things if we want to put more into the IMTP. It's difficult to just add more. So that process is going ahead. We're looking forward to hearing feedback from the Welsh Government and proceeding to get their seal of approval on the IMTP. And while that's happening, there are another 2 things happening. We've had reference to them in today's meeting. One is the work within the programmes, the DPIF programmes, following on from the change in funding, particularly the biggest ones that have had a more significant cut. So that's the NDR programme and the medicines programme and the maternity programme. They are looking at the resources and the programme of work they have. The team are reviewing that programme of work, and then they'll be taking it back to the programme board within the governance of each programme for approval as an adaptation to the delivery plan for those programmes. Then while that's happening, alongside that, we across the DHCW are using a group called the PPMG, which reviews all the milestones we have. And that's because we are looking not only at the programs, but also at our day-to-day work and our live services. They draw on each other and are interreliant and interdependent. So if there is pressure on the programs, then that can place additional pressure on our live programs or on our live services. And it also works the other way around, because there are live services that are anticipating things to be done by the programs. So in order to hold all of that together, then that group has been meeting more frequently over the recently. It usually meets monthly, but it's been meeting more frequently throughout April and May in order for us to be able to use that process of milestones to get clarity and then manage and control that through the year. So there's an awful lot of work going on. We're waiting to hear from the Welsh Government before too long, and I would welcome any questions or comments from members of the board. Thank you.
Diolch, Ivan. Any questions or comments? No, thank you very much for that update, Ivan. So we've been asked to
Simon, you've got hands up from Helen and from David.
Sorry, it came up after when I looked at my papers. Helen and then David.
Yeah, thanks, Chair, and thanks, Ivan, really, and the team. And just to kind of reiterate, a really helpful discussion, lots of engagement from across the Health and Social Services group, from Welsh Government colleagues last week on the call. Lots of really kind of good questions around specific areas. So yeah, as Ivan says, we await now through the formal process to hear what that means in terms of feedback around acceptance for the plan and how that impacts any accountability conditions that they may want to set in terms of the planned detailed delivery. But yeah, very helpful process so far.
David.
Thanks, Simon. Thanks, Ivan. So buried within the report is the feedback to Welsh Government on the impact of the reduced funding that we've got. Could you just speak a little bit to the timeline for getting that reprioritisation of programmes agreed with the relevant boards, and then something available to brief Welsh Government and the Programme Delivery Committee?
Yeah, certainly. Thanks, David. So each of the programme teams has done an assessment of impact in two different ways. One is by pulling together the delivery milestones within each programme scope and assessing impact upon those delivery milestones, usually framed in terms of a delay of a quarter or 2 quarters. There are very few that are being stopped. Most of them are just being slowed, if you like, in order to maintain the integrity of the delivery roadmap. And then there was also an exercise to assess the outcomes impact or the benefits impact as a consequence of the delay in those milestones. The programme teams have been working on that since April, so they're coming to the end of that process. In some cases, there's quite a lot of stakeholder engagement. Several of our programs are multi-party programs. So the NDR, for example, met last week in a workshop with health boards because it's a sort of a consolidated program between ourselves and health boards, and a large proportion of the funding goes to health boards. And then those, I've asked that those go back to program boards for their June meetings. Nearly all program boards meet monthly, not all, some meet bi-monthly. But we're looking to try to get through that in June, because I want to be able to have confirmed if this is what I'm aiming for as a target. But it's subject to the program governance, and so it depends on I work closely with the program chairs for each program, for example. But I'm aiming to have that work completed by the end of June, which means it'll be done in Q1. Then we'll be able to report that up to the Portfolio Management Board and up to the Programmes Delivery Committee, and they will be formally approved, revised delivery program delivery plans for each of those programs. And the program boards will then be assessing their delivery confidence against those revised plans, not against the original ones. Yep. And as we discussed at the PDC, we should then see a change in the RAG ratings, because currently they're self-assessing against the existing program plan, which predates the changes in funding.
Thank you.
Thank you, Ivan. Anyone else? No. Said earlier, we asked to note this report. I'm sure we're happy to do it. I've got a feeling if we carried on, we'd finish by 1:15. Are people happy to do that, or would you like to take a lunch break? Okay, I thought I'd get the thumbs up. Okay, so if we move on then and move on to the next item, the Integrated Organisational Performance Report, and I'll ask Claire to introduce this item.
Thank you, Chair. This is going to be a team effort, so I'm going to bring some of my colleagues in to comment on their performance over the last month or so. So April, the first month in a new financial year, and DHCW was busy with the start of its plan, which has over 500 milestones and a confirmed budget now of 168 million. And obviously our current headcount stands at over 1,268 people. So during the month, if you look at it in relation through the mindset of our missions, which is what is detailed in the portfolio reports, obviously our organisational performance report is also attached, which shows you our KPIs and our dashboard. If you look at our dashboard, actually it was predominantly green. There were 2 ambers which related to quality, which is me, but also pod, and there was 1 red, which is an amber which relates to operations. And I'll pick those points up as we go through the section. So in mission 1 and mission 2, which is providing a platform for enabling digital transformation, but also delivering those high quality products and performances. If you look at our performance during the months, we've made some real progress on APIs, and we've also looked at the proof of concept for the integration hub. We've also making progress on our SEAM procurement and implementation, but we've also undertaken and finalising our work in relation to the data centre move, and I'll bring Sam in a second. So that obviously had some implications in terms of some of our major incidents during the month. But again, if you look at and analyse those were predominantly around the Welsh Nursing Care records. So I'll hand over now to Sam if you wanted to add anything in relation to our operational performance in relation to missions 1 and 2.
Thank you, Claire. A couple of things just to highlight. So the operational, so the service availability remains high. So we were at nearly 99.97%, which is above our target. And it has been consistently since, well, throughout the course of this calendar year. And generally we're well above that target on average. We have, as Claire mentioned, had a relatively high number of incidents in this reporting period. Most notably were 3 with the Welsh Nursing Care record. So we have done some background analysis on that to understand whether there was a common theme, and there was. It was to do with some the way in which that system was accessing its underlying database, and there's a change that's been made and pushed out in the latest release, which has now fixed that problem. So that should go away. As Claire mentioned, the data center move is progressing well. We are on track to complete by the end of June. There's a slight error in the report because it says that we should complete by May, but June is the target, and we are on target to do so. I would like to take this opportunity to say thank you to the teams that have been working on that. There's a huge amount of work that's gone into this over a number of months, with many people working long hours and weekends to make this possible. And after a couple of teething problems at the end of the last calendar year, we've now moved forward very well, and we're on solid ground with that work. So we're on target to deliver. So a good opportunity to say a thank you on that. Just to highlight also that we have responded to the dental access portal requirements, and we're working very hard now to pull together an MVP for that. We had some glowing feedback from the Chief Dental Officer yesterday on this, so we're pleased with the progress that's being made, and we are expecting to have that released as a minimum viable product on the 12th of June.
Thanks, Sam. And within that mission, the other areas of note during the month was also some great work in primary care and mental health, not only adapting to changes in commercial arrangements in the market, but also in the preparations for the Connecting Care business case, and also with putting the final touches to a way forward for the digital eye care programme. So I'll move on to the next section, which is mission 3. And again, here we've made great progress in the NHS app during the month under the programme of digital services for patient and public. And also in mission 4, in relation to some of the outcomes in relation to innovation, there is also work that we are collaborating with the UK Research and Innovation Grant to develop an AI model to code and unstructure NHS clinical data. So again, some great work in that space during the month. And finally, to mission 5.
Claire, could you just mute yourself and unmute yourself with this? We're getting quite a lot of feedback on your sound feed. So maybe just mute yourself and unmute yourself and see if that fixes it. Go on.
Can you hear me now?
No.
No.
Okay, we'll have to tolerate it. It's not too bad. We can hear you, but it's we're getting
better.
Yes.
Yes, I've taken my headphones out.
No.
Okay. No.
Keep going, Claire. We can hear you.
Okay, so within mission 5, maybe it's at this point I shall hand over to SJ actually to talk and summarise some of the key highlights within the pod team over this month.
You hand it over to me, Claire. Okay. Just a couple of pointers on the performance side of things, really, and I think one of those is the appraisals. So the appraisals look as though they've fallen quite considerably, but this is a commonality of what happens at this time of the year. And I think when we sort of dug into that to understand that in a little bit more depth, it's really to do with the fact that when all of the organisations come together, and I think NWIS was TUPE'd in, everyone started on the 1st of April. So everybody, the majority of people, not everybody, but the majority of people have their appraisals at the same time, which usually aligns to the end of the one financial year and the beginning of the other. So there are some lower numbers, but we looked at last year's and the years before, and actually, even though they're lower, they're better than the previous years. Just to provide assurance to the board, all of the directors own this in terms of their directorates and their workforce. This goes through their senior leadership team meetings on a monthly basis. We also discuss this at the executive meetings on a weekly basis. So this is in sharp focus. I think you may have noticed that the executive one was particularly low. I just want to make sure that the chief executive isn't on the naughty step, just to provide assurance again to the board. That all of the executive appraisals have been completed, but due to the nature of how we upload this report for board and how they are registered on our system, unfortunately they didn't get loaded at the right time. So they have all been completed, and we are now at the objective setting. Some of the objectives have been done, others are being finalised and signed off. So just assurance that will reflect in next month's report that they will be back in good order. In terms of the rest of the activities that have been undertaken, we keep everything under sharp focus in terms of all of the KPIs, and there aren't any outliers in that space. But we're doing some really good work with, especially the directorate managers across the organisation, doing some really great work with my team and others in the directorate. So this is again in very sharp focus. So we keep this on the agenda, and it's a hot topic, and hopefully that can provide some positive assurance to the board that these things are taken very seriously by us all across the executive team, and indeed all of the senior leadership teams across the organisation, and to make sure that the statistics are of a good nature.
Thank you,
SJ, can you hear me okay? Okay, no, Chair, no.
You're still very muffled, Claire.
Well, we can hear you, but we're getting a lot of extra noise. Mind you, I'm getting a little bit of feedback on me now, so I don't know what. Maybe the Zoom feed is a problem. Carry on, Claire.
Okay, and what SJ didn't actually talk about is the big step challenge that we introduced in DHCW in the month. So we had 34 teams across all directorates and 252 people taking part to encourage health and well-being across the organisation. So just to say, the performance indicators went quite extended in the month. Other things to note is that in terms of our quality performance, we are focusing on achieving the IMS documentation up to where it should be. So we are running very closely along with the local SLTs to make sure the quality procedures are updated. And then finally, in terms of our audit actions, we've got 27 audit actions on track. That was subject to agreement from the Audit and Assurance Committee that we could extend the deadline on a couple relating to an IT system development within the finance team. So during the month, the number of audit actions completed fell from 33 to 17. So there's still quite a lot of activity to ensure completion of that. There are no key risks or matters for escalation to the committee, so I'd like you to receive and I'm happy to take any questions, Chair.
I was on mute. That's because they muted me out there. Marion.
Thank you, Chair. Sorry about that. Can I ask and say thank you to Claire for her really comprehensive presentation. Could I raise a question about the NHS app? We are aware that we are still in the midst of the public beta period, the experimental phase, which has been set aside to try to resolve any bugs or problems relating to the app. It's good to see that the number of complaints around the process or in relation to the app as it currently stands, the number of complaints is reduced. But it's clear that there are some issues, and I noticed in one of the national papers that there are letters noting frustration about the app as it currently is. The question is, are we making it absolutely clear that the app has not yet been complete in terms of the process of experimentation and the testing process, and that we are still trying to find out and resolve any problems that there may be? It's really a question of handling how we respond to these complaints. And it's a question really, have we been clear enough as to what phase we're actually in releasing the app?
And if I can add to that, Marion, I'm also concerned that we make it clear that functionality, for example, my GP practice doesn't offer appointment booking through the app, is a responsibility of the GP practice, and it's not to do with the app. And also make it clear that, I think the reference, one of the things you referred to is in that article is what other functions there might be, and what other functions there might be is very much dependent on what funding we get to add functions. So I think we do need a clarity of communications around what is us and what is out with our control currently. Marilyn and then Ivan.
Do you want me to come and respond to?
Go on, then you respond to that, and then I'll bring Marilyn in.
Sure, thanks. I listened to Marilyn in English, which is quite strange, but that's because Ridin and I are sharing a laptop. So I'll reply in English as well, weird though that feels to me. We've not done a huge amount of promotional campaigning around the app to say, to push an understanding of it being still in a public beta phase. It is included when we respond to, if there are individual inquiries and individual complaints as they come in, then we help people to understand what a public beta phase is, and there's a narrative around that. But we haven't strongly promoted anything around the app. And the second bit is that there are many partners and parties to the features that a patient would see in their app. It depends on what is enabled by their GP. It depends to some extent as well on whether their GP is using a Cegedim or a EMIS practice, and whether they still have access to My Health Online, which some people will and some people won't. So it's quite confusing. So we're responding to that in two ways. One is that we are coordinating and carefully monitoring the feedback and the issues that are arising. So we do that through the app itself, using a piece of software called Qualtrics, which takes feedback within the app, and we get thousands of questions and thousands of comments and feedback queries, all digital, all through the app, which we're able, all in text, which means that we can then analyze those to understand areas which are causing friction for users. And then we've also got we've established a service desk within DHCW to which we route incoming calls. Now, and I just want to emphasize, I'm not for a moment saying that the numbers are so small we shouldn't worry about them. We are absolutely worrying about them, which is why we've set up a service desk But currently, we're loading about 1,000 new users per day, roughly about 1,000 per users, up to 1,000 or certainly 5,000 new users a week. And the number of calls coming into those desks are around, they're fluctuating between 30 and 50 per week coming in. So yes, there are issues, and we're taking the issues very, very seriously, and we're looking to resolve those, particularly where we can see systemic technical issues and glitches in the system. And we're working very closely with our software partners like EMIS GP Systems, for example, to resolve those as quickly as we can. The second thing that we're doing is we're working with Welsh Government on when to run a public comms campaign. It's still a modest comms campaign, so it's tens of thousands of pounds that we're proposing to invest in this, not hundreds of thousands or millions of pounds. But that will signal that the app is moving out of the beta phase and into more of, or moving closer to, or all the way into live deployment. But to get there are a couple of things that we want to provide the government with assurance on, the minister specifically, and that we need to still iron out. There's one is a technical issue about identity verification, and the second is about trying to be able to provide a consistent offer to the public across Wales about what they can expect to get from their GP, and currently that will vary GP by GP. So there's a couple of key things that we want to work with, all focused towards clean comms, providing people with as much certainty as we possibly can. In the meantime, though, we're keeping a very, very close eye. We're taking daily and weekly reports on the incoming calls to try to stay on top of it, and have a grip and respond to users' concerns as they come through. I hope that's helpful. It was quite a comprehensive answer, but clearly the app is really important, and the bigger picture is that numbers are, they're really ramping up. We passed 200,000 users about 2 weeks ago, so they are moving very quickly, even in the absence of a comms company.
Thank you, Ivan. Marilyn.
Yes, thank you for that comprehensive feedback. One of the things I wanted to say was that if this was something that was highlighted to board before, because I know it's something that I brought up previously about us having responding to queries. So I'm really pleased that we've set up the help desk around that. And I think that one of the issues around this particular area, and I think it's something we've discussed before, is us not having direct contact with citizens and them not realising where our responsibility stops and the GP practice takes over. So I think, like you said, I'm really heartened to for you to say that in the future there's going to be some comms around that, because I think that'll iron out a lot of issues and a lot of perhaps sometimes misinformation, because with my other hat I hear things in the community, so sometimes it's people not understanding what it can and can't do. And I think so sometimes there's criticism around things that it won't be able to do anyway. So I think the comms will really make that clear to people in the future. So Chuck and Val, thank you for that. Yeah.
Thanks, Marilyn. Claire, did you want to come back on anything else? Or have you? No? Okay. Any other comments or observations, questions? No? Okay, so we've been asked to receive the performance report, which I'm sure we are happy to do. Thank you very much. If we move on then to some highlight reports for committees that have occurred since the last public board meeting. And the first one is the Audit and Assurance Committee. And if I could ask Marion Wynne-Jones to present any highlights from that committee meeting she would like to present.
Thank you, Chair. And it's a pleasure for me to present the report from the Audit Committee held on the 16th of April. We had two audit reports, internal audit reports. The first was on programme management, and it's good to say that we were given a reasonable assurance. It was good to see that. And the second internal audit related to the digital programme on iCare. We had a positive review confirming that the process is in place as we adopt this programme from Cardiff and Vale Health Board to enable us to establish the status to the programme as we take it over. And finally then, could I just draw the board's attention to two examples of compliance failure on standing financial order. This is not the first time, of course, for this to happen, but as a committee, we were given an assurance that there is a strong programme of training in place to try to ensure that this weakness will not occur in the financial instructions. Thank you.
Thank you, Marion. Any questions or comments? No, we received that highlight report. If we move then on to 6.6, which is the Programme Delivery Committee highlight report, and I'll invite David Selway to introduce any highlights he wishes to.
Thank you, Simon. There's three things I wanted to pull out. First was the overall programme dashboard was a lot redder than it had been the previous month. In large part, this was down to the funding issues that we've already talked about in today's meeting. The reprioritisation and planning that Evan's referred to should see some improvement when we next revisit that, but that's something I'll be keeping a close eye on. Another item we wanted to alert was the new governance model. There are some gaps in the appointed programme chairs. This is not anything we have control over. It's Welsh Government that appoints the programme chairs, but there was a concern that the lack of those programme chairs meant that programmes weren't being properly supported. And the final point I wanted to pull out was we had really good deep dives on the LIMS and risk programme. Alison gave really good confidence that those programmes were well on track. The only thing I wanted to pull out was that we'd spent a lot of time trying to deconflict the implementation programme for those two from a health board perspective. But with regard to risk, the revised plan from our supplier for implementation means that some health boards will now have an overlap where they weren't previously, and there is an element of risk from a health board perspective around those programmes. So those are the three things I wanted to pull out of the report.
Thank you, David. Now, I listened to the committee, and the work that Alison and her team have done on LIMS and RISP is fantastic. It's given where this board knows we were not many months ago. It's been a remarkable progress and achievement. Helen, you want to come in?
Yeah, well, to echo that point actually around the diagnostic programmes, but notwithstanding there's still a lot of risk involved in those programmes, as we're all fully aware, but great to see the progress that's being made there and the good relationships that both those programmes have with their suppliers, albeit that, you know, that we've got some revised timescales from the risk provider, but we're working very closely with them on that. And just to say on the programme chairs, we've had some discussion with Welsh Government and some, I think there are some suggested names to fill some of those gaps. So there's an active discussion going on in Welsh Government in terms of some of those programme gaps that we have. So it'll be really good to see that and see those gaps being closed.
Ivan, you wanted to come in?
Yeah, very briefly, thanks for the opportunity to comment. So this is the third Programmes Delivery Committee. I felt that it was showing that it was sort of maturing. It felt different to the others, and in particular the conversations that we were having about the way that programme boards were using the RAG framework to self-assess their delivery confidence in their own programme. That was a slightly different discussions to the ones that we had before, and I thought also that another thing we were able to pull out was the difference between the forward look of the programme board's assessment of delivery confidence to the end of whatever the programme timetable is, which sometimes is years ahead, versus a sort of a retrospective review of, well, how has 23-24 gone then? And in some cases, there's been really significant progress and really good delivery in some of those programmes and a real turnaround, and LIMS and RISP were two examples of that. And it was, as others have said, a very good presentation. And they're two quite different things, you know, have we had a good year, and are we still on track to achieve what we want to deliver over the next 2 to 3 years, given the changing context around us? They're two different questions, and I felt that the discussion in the committee helped to bring that out in a way that it hadn't before, and that's just, for me, is a sign of how the new arrangements that we put in place over the last 6 months are starting to bed down, starting to get a grip, and helping us to get our heads around the things that we're managing through these programs.
Thank you, Ivan. And thank you, David. We received that report, but don't go away, David, because you're on again. If the Digital Governance and Safety Committee report, and this is, if you recall, David had stepped into the chair during Rowan's interregnum. And Rowan will be taking back the chair after this meeting, but David was in the chair for the one held right at the beginning of May. So David, if I can invite you, if you've any highlights you want to.
Yeah, I'll just pull a couple of things out, Simon. So big picture, we received assurance on a wide range of programs. There was nothing that we wanted to alert. And with regard to the risks that were assigned to the committee, the overall risk score had decreased. So by and large, it was a positive meeting in terms of assurance. We did do 2 deep dives, which is the thing I wanted to pull out, around the development of the IG toolkit and the ongoing development of our data protection officer support service for primary care. We had really good sessions on both of those. There's some excellent work that the organisation's been doing in both of those areas. And I just wanted to take the opportunity to raise that up to the board to say we'd received that and we're really pleased with the work that's been done in both of those areas.
Right, and Rowan. Sorry, David, go on.
Yeah, Rowan was attending.
Yeah, I know.
I just stop to see if Rowan wants to add anything.
I think the only thing I would say, David, is one of the things that really struck me was the clarity in the committee's business that has come from splitting out the DG&S agenda from the programme board. And I think, you know, just in terms of overall sort of assurance across the organisation, I think that's going to be a really good thing. And you know, clearly, yeah, that was really apparent in this committee meeting, and we had some really good discussions, particularly in the private session, which were really good to do.
Thank you, Rowan. Helen?
Yeah, I just wanted to echo what David had to say about the IG toolkit work and the DPO, the Data Protection Office, that we provide to primary care services. And some of that work goes kind of under the wire, doesn't it? It's all the stuff that keeps us safe and all the stuff that supports the service to be able to provide the assurance that we are doing things as a system in the right way when we're handling patient data. So just to say a well done to the team, really, our IG team there, and not just that, they're expanding that service, and it's, you know, it's funding itself through the, you know, it's created a level of credibility and reputation out there to services to say that more primary care services want to access that kind of expert DPO service that we provide, and to have that support in terms of the IG toolkit completion for Wales. So just I was lucky enough to Sam Lloyd yesterday to have a bit of a deep dive into the work that they're doing, and it's just tremendous, really, the way that is kind of, you know, is improving constantly and constantly doing that work to ensure that everyone is aware of their responsibilities and are aware of how they need to assure the fact that they are, you know, meeting those responsibilities under data protection. Thank you, Chair.
Thank you, Helen. And we're asked to receive the highlight report, which I'm sure we're happy to do so. And to continue with David, the last highlight report is from the Independent Member Digital Network, which David is the Vice Chair. Is there anything particularly from the last meeting held towards the end of April that you'd want to bring to our attention, David?
Yeah, I'd just pull out two items, if I may, Simon. The first was we received an excellent presentation from Meridian, our Executive Medical Director, on digital system availability and uptake, which prompted a rather long discussion about from health board members in terms of where they were at. There were a few curveballs thrown in Meridian's direction, which he handled expertly, and I'd like to thank him for that. And the other thing I'd like to pull out is the presentation from Darren Lloyd on information governance, which again was very well received. And reflecting on our earlier session on stakeholder engagement, my feeling based on things that have come to the digital network are that around information governance and cybersecurity, we're well ahead of the game in terms of where we're looking to be in terms of being a trusted strategic partner. And that particular presentation was again really well received by the network.
Lovely. Thank you very much, David. Oh, Rowan, you put your hand up.
Yeah, really just reflecting on what Helen said prior and David's comment. I think people are aware that in my other job, where I was with my interregnum, I work with a lot of organisations with patient data. You know, DHCW and the leadership it shows across Wales, particularly the work that I see with WASPI and Code of Contact, you know, the tools that we have are not universal. It is something I think that is part of our strategic muscle across Wales that we take for granted because it runs through what we do, but isn't necessarily present in other organisations. So, yeah, just wanted to say that really, because it's important and it's part of the bigger discussion that we have in terms of engaging with the public about the safety and security of their information.
Absolutely. Thank you, Rowan. No other comments. Okay, if we move then on to closing matters, I've had no urgent business, any other urgent business indicated to me. So unless I see anything, well, thank you. And the date of the next meeting is Thursday, the 25th of July, and that will be a public board meeting like this. And then in the afternoon, I think we're scheduling it for about 3 o'clock, will be the 2024 AGM, annual general meeting, and further information on the format of that will come out in due course. So I'll bring the meeting to a close. Thank you all very much for your contribution and the slickness of your contributions. Have a good day, everyone.